Well, many people are preparing for the Crescent City Classic, which is less than 2 weeks away, and you'll see more and more races pop up as spring goes on. Dr. Leon Watkins, a podiatrist at Gulf South Foot and Ankle, joins us now with some tips to prevent injuries for runners of all abilities. Thank you so much for joining us. Sure. Well, some people try to do too much too fast. I mean, if you're not a runner and then you all of a sudden run, that's not good, is it? What should we do?
So with the weather getting nicer, people are getting back into the routine. It's important to remember you can't start where you left off in the fall. You're deconditioned over the winter, and you have to break in slowly.
So slowly means?
Slowly means start off slow, but a good thing to remember is you need to do a good warm-up routine, which involves stretching. And there's a few stretching exercises I like to talk about for the feet.
Okay, tell me.
So one is called the calf raise, and basically you put your foot on the on a curb or a step and raise your heel above and below. And then this one here is the foot roll, where you roll your feet in large sweeping motions to stretch out essentially every joint in the foot. It's a great exercise.
You know what? I have never done that in my whole life. So I've learned something today. All right, and shoes make all the difference too, don't they?
Shoes do, yeah. So shoes should be firm, and a good way to test to see if your shoes are worn out is when you bend them like this. They should be relatively sturdy, and when they finally bend, they should bend where the toes are bending.
Okay,
with a worn-out shoe,
yeah.
The integrity of the rubber is lost. They become very loose. When you do that same motion, you can see that the shoe essentially folds in half. So this is ready for the trash.
Interesting.
Yeah.
I never knew that either. So we should keep it.
Firm one.
That's hard.
That's right.
This is a good shoe. All right. Some people get plantar fasciitis. That hurts a lot.
Plantar fasciitis.
Sometimes it's from running?
Yes, plantar fasciitis is very common. We see a lot this time of the year, and oftentimes cortisone shots and anti-inflammatories are temporary at best. So there's a new procedure out called the Tenix procedure, and it involves a little probe, a little handpiece like this, and it's got ultrasonic waves that shoot out the tip of it and essentially liquefy the bursa, any inflammatory tissue, any damaged tissue, and there's a suction collar that then suctions that tissue out. It's minimally invasive, and it's all done through this little probe right here. Takes about 15-20 minutes, and you're walking in days, and you're back running in 2 weeks.
How new is that?
It's been around for about a year or so.
Okay, I figured it, because I've been told to wear an insert, but this wasn't out.
Inserts are great too, but this is a new one when you got that stubborn case, it won't go away.
Awesome. Is there anything, like sometimes as you get older, I guess the padding on the bottom of your feet kind of diminishes? Is that true?
Yeah, as we age, that soft tissue will thin out, and that's where inserts and again a good rubber sole will greatly help that.
Is there a procedure to kind of plump that up as well?
There's injectable silicones they have as well that you can put under the ball of the foot and even under the heel that will essentially replenish that soft tissue. Okay,
anything else you can tell us? I'm not a runner, but for runners, what should they do before this race other than just stretch?
So the main thing is to start your workout slowly and work yourself in, and make sure you do a lot of stretching beforehand.
Perfect. Thank you.